comes. Peter will just talk for 2 or 3 minutes, and then we're going to jump into the second half of our CHI meeting today, which is about the surge in COVID-19 cases and what we as a community can do. Hope you all are taking great notes. This is lots of interesting stuff that's being shared today. Go ahead, Peter. I'll pass the virtual microphone over to you.
Okay. Thanks, Alana. Can you hear me okay?
Yeah, it's great.
Okay. Well, without repeating what a lot of you already know, I want to make sure that people do know that the Okanogan CHI, in support of Okanogan Public Health, has decided to stand up a communication strategy to make sure that all Okanogan County residents have access to reliable, current, authoritative, and locally relevant information about COVID-19 and what's going on. So this includes a website, a social media platform, public service announcements, and other things to be determined as this progresses. It also has an outreach strategy to make sure that we get this message out to as many people as possible. So the website, for those of you that have not been there yet, is called Okanogan County COVID19.org, and it's up and running. It was up, I think, just about the time that that big spike that Crystal's data showed in cases, and we struggled initially with data issues and overwhelm, but we've got that sorted out right now. So what the website has now is current information on cases and cumulative counts by town in Okanogan County. So that's being posted every morning for the previous day, Monday through Friday. It has an explanation of the data, so if you have questions about where they come from and are they consistent and what's there and not there, there's a great write-up that I encourage you to read before you start sending questions. It has a frequently asked questions section, and also a Mythbusters, and then lots of info about what the current standards are based on the phases of progression through the COVID epidemic that the state has put out. So what's required, what are we supposed to do, employers, schools, everything. There's tons of information there that's locally relevant and current. The public health does have a Facebook page, so we're curating a social media platform to address this. So a lot of the information is replicated there, but it's also an opportunity to dialogue in a respectful and informative way to make sure that we reach as many audiences as possible. And then we have a outreach strategy. So we've got an advisory group that represents all of the towns in Okanogan County, and this advisory group, the advisory group members are responsible for reaching out to key stakeholders in their community to make sure that they know this is available and that they link to this, promote it, and give us as much feedback as possible. And the last thing I'd say is that you're all stakeholders and you're all advisory members, so please weigh in, give us feedback on this, make sure that all your contacts and influential people that you know are informed about this and use it. And finally, we are working on our Spanish language version of it. It's about one step behind, but that should be coming up shortly. So thank you.
Thank you, Peter. I appreciate it. Okay, well, let's shift over to our next panel of folks. One moment. I think what I'll do while we add these folks in here is I will show my screen again so you all can just take one more look at that data. Working on it. We'll get there, I think. Most likely we'll get there. Okay, well, y'all can see the panel in front of you. Let me also add Lori Jones in here. Chris Branch, the other one that's joining us. Okay, thanks for your patience, everybody. We're almost there. We invited the panel who you all see in front of you to answer the question of why the sort of there are 3 reasons of why they think there's a surge in COVID-19 cases. Panelists, if you don't mind, I will let you introduce yourself as you answer your first question. The first question is, why is there a surge in Okanogan County cases? And then we'll pause and I'll ask you the next question, which is, what can we as a community do to take action? Let's go ahead and have Jimmy start us off, which are you feel like sort of 3 reasons why we are seeing a surge in Okanogan County COVID-19 cases. Thanks for joining us. Jimmy, can you hear me okay? There he is. Nice. Jimmy, can you hear me?
Yeah, there we go.
Nice.
Sorry, I'm on internet and had to switch over to my phone for audio.
Okay. Go ahead. Yeah, first question of why do you think there's a surge? Top 3 reasons, and I will say we'll limiting each person to 3 minutes, so you may see me pop back on.
3 minutes. All right, kick me off when I'm hit 3. So just briefly, I'd say COVID is doing what COVID does. Now's unfortunately our time to get it, and it's impacting our most vulnerable populations the most. So 2 key things we know in all the new knowledge about COVID, it's got a high viral load early in the illness, even before people develop symptoms. And then the incubation period is relatively long for such a virus. And so that means a lot of people can spread it before they know they have it. And after they get it, they can disperse broadly and infect a lot of people before they actually get sick. And I would say it's our time out here in Okanogan County because we're rural, we've been buffered, and we've done a lot of things to successfully avoid it until we got hit hard. So we were delayed and buffered from Western Washington. They got hit hard in March and April, but they first got it in January, so that there was a little bit of a lag time. You know, we first had our cases in March or April and saw a little bit of a lag time, and then May and June is when we started spiking and we're getting hit hard. That coincided with everybody doing a good job with initial compliance with the stay-at-home order and the shutdown. But as things expanded, we started interacting more, and now we're seeing some of the impacts of that. Those communities that did first get it responded really well in masking, distancing, and they seem to continue to do really well in those processes, and at this point aren't getting hit quite as hard. And I'd say we're surging also because it's gotten in to hit and impact our most vulnerable populations. So our essential workers, frontline healthcare professionals, educators, agricultural workers, are all working because their work is essential to the health and vitality of our local economy and our communities. And when they're not adequately protected, they get COVID. You know, I would extend that concept of essential workers to the individual and family level, and many people are essential workers to their family. And so when their family depends on their work, especially during harvest season for a paycheck, they're going to continue to work. And we're seeing that. And that structure of the way many people live is one thing that's contributing to this explosion that we're seeing. Our folks in congregate housing, so close quarters, nursing homes, jails, migrant housing, overcrowded housing with you know, families living packed together, find it really difficult to isolate and quarantine. I quarantined last week. My son spiked a fever, and so we got him tested. Wasn't sure if it was or wasn't, but we quarantined, and we found it very easy with 2 parents who were both able to partially work at home, isolate on 5 acres of land, have tons of friends, and others offer to bring groceries and support us through the process. And that's a very different experience, I think, than many of our populations are facing. So much of this boils down to social determinants of health. I think the lack of access to reliable and actionable information has also hamstrung us to a degree. I think the new communication platform from public health is just catapulting us ahead of where we were earlier. But healthcare access for folks that work 6 to 7 days per week limits their ability to access both services as well as information. And that information needs to get out into the communities, and it needs to empower the communities to be able to make the right decisions for themselves and their families. And if we are not able to get the communication out there, it doesn't matter what our healthcare system does. It's really in the hands of our community members to prevent and fight this. So getting trusted, reliable information out there is important. It's not there on social media and not often there through the news media. So we need to replace the misinformation with good information. I think there's a lot of misinformation and distrust, even among ourselves and community leaders. And we need to all get on the same page and make sure we are aligned in our communication efforts. I'd say this is a crisis, and we need to be treating this like a crisis. It's killing people. I filled out more death certificates in the past couple of weeks than I have in the past couple of months. And it's not just COVID, but it's the complications and exacerbations of disease that might go with delayed treatment. We talk a lot about and often say that the measure of a community is how well it cares for the most vulnerable members among us. And I think in the time of COVID, our success is going to depend on how well we serve the most vulnerable community members in our county.
Thank you so much, Jimmy. There was just no way I could stop you. I think it's all too important. So I really appreciate it. That was excellent. Alan,
running over.
Yeah. Alan, let's pass it over to you. The question is, why do you, from your perspective as a healthcare administrator, has there been a surge in Okanogan County? Oh, Alan, you are muted.
There we go. Can you hear me okay?
Yes, we got you.
All right, great. Well, what we're seeing today is a lot more testing being done. COVID's been here. It hasn't gone away. But what we're doing is by testing, by finding out where the pockets are, who has them, we're able then to identify what's really going on. That's just one aspect of it. Here at Mid-Valley, we've treated, last week actually, we had 5 COVID patients. Our emergency room is seeing anywhere from 35, 40 patients, a good number of those COVID related or possible. And again, with that testing, with the capabilities that we have, we're finding more folks with that. But the other side of that too is what I'm seeing. At least I had an opportunity yesterday to work in the clinic and do the health screenings. And 1 out of every 4 patients that would come in were not wearing masks. They were not practicing social distancing. And then when asked to put on the mask, of course, we give them one at the front door. Very argumentative. So I think, again, back to what Dr. Wallace was saying earlier, it's about the education that we've got to get out there. And these folks that I would call mavericks need to settle down a little bit and take a look at what we're seeing statistically. That is masking up, social distancing. Those are the parameters that we all need to follow. We just have those outliers that are not following, and that's what's contributing, in my opinion, to the wide variety that we're seeing out there of more COVID patients.
Thank you, Alan. I really appreciate that. Scott, let's pass it over to you.
Can you hear me okay?
Yes.
Thank you. Appreciate the opportunity to address this important issue. And I would agree with Dr. Wallace and Alan. It's, fundamentally we as a people, we're independent minded and we don't like being told what to do. And so I think there's fundamentally a resistance from a lot of folks to follow guidelines. There seems to be a lot of skepticism around science and much higher regard for personal civil liberties. And so what ends up happening is the civil liberties discussion or point of view trumps the science point of view, but the science is pretty clear that wearing a mask and social distancing works. And so, you know, but human behavior is hard to change. People are social. This has been super disruptive to people's lives and they want to get back to normal. And there are enough people who are not following the guidelines, and they're the vectors really to continue the transmission of this illness. My kudos are off to the many people who sacrifice to wear masks and to do the social distancing and to follow the best health practices out there. It is a difficult thing to do, and it requires discipline. But we should really honor those folks who are doing those things consistently. I don't know what to say about the Mavericks that Alan references, because it seems like education doesn't have the impact that it might otherwise. So I think we just have to continue to do more advocacy in a more prominent way and continue educating people. And I also think that the healthcare community, healthcare professionals everywhere have to be the examples. When we see a healthcare professional not wearing a mask or not social distancing, that undermines everything that we're trying to do. And so I think we have to be really good examples. So that's my take on it.
Thank you, Scott. Oh, it is so helpful and so interesting. I really appreciate it. Chris, let's pass it over to you. Chris, you are muted still.
I am now unmuted. Can you hear me now?
Yes, we hear you.
Okay. So let me try to keep it simple, but I first want to just quote a guy that was interviewed in USA Today, Arnold Monto, professor of epidemiology at the University of Michigan School for Public Health. He's asked why numbers are up for most of the country. The phased reopening of the economy results in the perception that the virus is under control or to some extent non-existent. Fold in the influence of politics on public perception, where numbers are regularly debated, and the risk of the virus is downplayed, where numbers are regularly debated, and the risk of the virus is downplayed, which results in the public's precaution level being compromised. People are more inclined to travel and engage in various activities that without extraordinary precautions increase risk of transmission. So there's an example in my neighborhood. I talked to a young man, never seen him wearing a mask, and he says, it's all a bunch of garbage, isn't it? And you can imagine what my answer was. Secondly, I think the increase in testing, of course, increases the numbers, like most people know. There's not a question in my mind who gets tested and when affects the numbers, so be it. We want to know where the virus is going. If we increase testing and the numbers go down, we like that, but we'd have to take a closer look if we saw that trend. That's not what seems to be happening anyway. And then I think the third, from my perspective, is certainly we have harvest coming on. That's been mentioned by James. It's not just ag, though. I mean, in those communities with processing facilities across.
Oh, Chris, we lost you.
So
there you go. Okay, back.
And that's my view generally of why the increase. I think I'm hearing something very similar from the experts we have here and those that are experiencing the virus firsthand.
Chris, would you mind repeating?
Did you get all that, or was?
I think we got most.
Go ahead.
The last part we missed was about the agricultural. I heard you say that agriculture is about to pick up pace again, and we missed just that little last piece. And I appreciate that you're talking about ag and industry.
Yeah.
It's a really important place for us to lift up.
Yeah, well, just early in the process in the state. I mean, I talked to a lot of county commissioners across the state, And those counties with processing facilities, whether it be ag or whatever, where people are working together in a processing facility, obviously you're going to have a opportunity for the virus transmission, and thereby increasing numbers there. We saw that very early in Walla County. And so it doesn't surprise me the harvest is increasing the numbers. And of course, with contact tracing, we're going to get higher numbers.
Thank you. Thanks, Chris. I think we caught that. We got all of it by the end there. Thank you.
Okay.
And Lori Jones, you are a panelist, but we can't see you. Can you hear us okay? She is muted and her video is off. Here she comes. Lori, let us know when you are in. Otherwise, we will move to the next question. Okay. Let's go ahead and actually what I'm going to do real quick, Michelle and I were taking notes as you all were speaking. So I am going to share my screen so you can see a little bit of the summary of what we just heard here. So that's in terms of summary of why the surge. We heard vulnerable populations are impacted most, insufficient housing, social determinants of health, really reflecting that depending on your socioeconomic status or the demographic, it's harder to isolate, stay away from high exposure locations, or stop working. Trusted and reliable information feels difficult for people to come by. We're still working on alignment among key providers across the county in terms of how we respond to the virus and what the virus means. More testing needs to be done. Low compliance with masks. I think Alan's word was quite a few rogue folks out there. Low compliance, not just with masks, but social distancing, and a high number of adversarial views across the county. Some skepticism on science and a perception that civil liberties might be more important than good science. And of course, politics are impacting views and reducing people's willingness to comply. People want to get back to normal right now. It is summer, and there's a lot of social activity that's just, I think, a natural inclination for folks. And the education strategies that have worked in previous pandemics or previous moments that might resemble this are not working in the same way as they are now. Thank you for that. I am going to ask you all the next question, which is, what are the actions we can take as a community? And I encourage you to consider the audience, which is this CHI membership, and give them direction or information or reflections that you think are important. What can we as a community do to slow the incident rate of COVID-19 cases right now? And encourage you to be thoughtful, specific, and I will pause occasionally and dig in a little bit. Let's have that go back over to you, Jimmy. We'll have you kick us off.
Yeah, so I think about different levels where we might be able to intervene. One thing, I think this coalition is probably the strongest body to hear from each other and then take that information back to our organizations and work towards more alignment and work towards better using our resources to serve our populations. But when I think about how we need to empower people to better isolate and better quarantine, our contact tracers or our staff in clinics who are doing the care coordination and providers as well need to provide that education in a context that each individual understands and is realistic for them, identifying barriers that they might face or their family might face to succeeding in recommendations for isolation and quarantine. And when there are gaps in their ability to achieve that, work within and in partnership with other organizations to try and close those gaps and make it possible for people to isolate and quarantine. I wouldn't be surprised if each of our organizations aren't in a degree of upheaval in trying to figure out how to allocate resources, but I think now's an appropriate time to reallocate our resources and what we do, either for an interim period or considering in the long term, how do we devote our resources to the people that need them the most? And I've seen hospitals doing that. Those of us on the call have worked together And I think just drawing as many people in to help ourselves scale up or to spread out and serve additional needs if we can focus our resources in some areas. And then I think we need to do everything we can to empower our leadership, the county leadership and our community leadership, to prioritize and protect the health of our communities and our county as a whole. If we don't see alignment from the top, I don't think it's going to reach everybody it needs to reach. And I think we're going to continue to have misinformation and confusion and I guess in support of, to use Alan's term, just support of the mavericks out there that I think are contributing to the problem.
Thanks, Jimmy. Alan, we'll pass it over to you. Again, sort of specifically, what actions can our community take to reduce COVID-19 cases?
Yeah, first of all, our message has got to be consistent. It's got to be consistent at the county level, whether that be from the commissioners, which for the most part they are, but to the law enforcement agencies. They've got to be impactful as well. And we've got to make that point. I think though, as much as we want to do the education, whether it be at the clinical side, at the clinic side, hospital side, that's never going to be enough, because again, those small elements of folks out there are the ones that are going to carry that virus. They're going to say, I'm not going to get it, but they will. And until they listen, and until we're able to come up with a message that is impactful, I think in my mind that's the word, impactful message, so that we can get across to them how that might be. Now with public health, and I heard earlier about the CHI's website, I think those are great ways of getting out to the community. A lot of us are putting our the various messages via our own Facebook. That seems to be working. But again, the minority element, when I say minority elements, those individuals out there that are not participating, wearing masks, practicing the social distancing, those are the ones we need to figure out how to connect with. I don't have an answer for that. Again, it's as Scott was talking about, it's up to their own conscience to decide, do I want to be part of the community or part of the problem?
Thanks, Alan. I heard you say that our message is inconsistent across our leadership. In what way would our message change if it was more consistent? And you also said it would be more impactful. Do you have a sense of what a more impactful version of our messaging is?
The first part of consistency,
yeah.
In reading earlier statements from various officials, whether it's the sheriff's department, whether it's a county commissioner, we've all got to be on the same page.
Yeah.
This is not a conspiracy. This is an actual pandemic that we're all in. This is something that, frankly, I take serious. My assistant, Megan, wanted me to give a shout out that she's at home right now recovering from COVID. And again, it could affect, and she practices the distancing, the masking, everything. And so do we here at the hospital. None of us have got it in administration. But again, those one or two people that don't do it out there, something happens, so people get it. So that's the consistency in the messaging I'm getting at. I think we all have to be on the same page. This is a pandemic. This is not a something that is a conspiracy out there. Impactful, you know, we talked about years ago, scared straight. I think that's what we have to do with some of these folks out there that will not comply. Somehow we've got to scare them to the point that, hey, wear that mask, practice that social distancing. And I think we do that. I think we will see the curve either flatten or at some point in time go down. Now, when I say go down, it's not going to go down immediately. Like any other pandemic we've seen, it takes a long while. I think this one is no different.
Thanks, Alan. Scott, I'm going to pass it over to you. Specific actions you think the county could take to reduce incident rates of COVID-19?
Well, you know, again, I think that we have to be realistic about adherence. And we, after 50 years of trying to get people not to smoke, still have people who are smoking. And so I think that the reality is we're going to have folks who want to go their own way. I mean, we could always go with shunning. That kind of combines shame and social distancing at the same time. So you might get some benefits out of it. I'm just kidding. But I think having some kind of education that helps people to feel personal responsibility to other people might have an impact. You know, one of the main reasons I try to follow all these guidelines is because I don't want to get sick, but there's another reason. I don't want to get my wife sick, and I have my 90-year-old father-in-law living with us, and I don't want to get him sick. I don't want that on my conscience. And that sense of personal and social responsibility needs to be magnified during these times. And so I think campaigns or education or, you know, tactics that we can all learn can help us to confront some of the wrong-headed anti-science mindset. But, you know, in this day and age, you have to also be careful how you do that as well. So I think that it's a difficult needle to thread, but at the bottom line here is that we all have to be examples of it, and we all have to be willing to speak out about it and correct the wrong perceptions. My neighbor came by the other day without a mask and wanted to talk to me out in the driveway. And you know, I had my mask on, and he asked me, "Isn't this just all a bunch of political junk?" And I said, "Are you kidding me? I work at a hospital. I see what happens all the time. This is very real, and you're taking a huge risk by being here without your mask on." But I think a lot of folks feel funny about saying those kinds of things, but I think that we need to get more comfortable with that.
Thanks, Scott. That's a great addition. Chris, I'm going to pass it over to you.
Well, I follow you all. I think one thing that's really important that's been happening, and I associate with a lot of county commissioners in Eastern Washington across the state, and there's a constant debate over the numbers. And, you know, I look at the numbers and I look at them from a trend standpoint. I'm not going to debate the numbers because it's pretty clear what's going on. And when we opened the economy, I remember being at the health board meeting and wearing a mask as I went in there. And don't get me wrong, I'm not perfect in that regard. Sometimes I find myself without one, but more often these days I do, as an example too. But you know, when we were asking for a variance, I was joking around in a way with my mask on and said, "How do you ask for a variance with a straight face?" And I said, "Wear a mask." Because in fact, I did, and many of us on the health board, I think people that are working with, expected the numbers to go up as a result of opening the economy. And you know, when you say as a county commissioner, which we're not the ones that really open the economy, by the way, but when you say that, it's like, okay, the door's open, everything must be okay. And you'll see then people loosen up. I mean, automatically, immediately. And so those are messages that elected officials need to watch. I see the elected officials across the state that have been filing suits and those things late or earlier in the game. I don't hear that much from them anymore because I see they know the numbers are going up too. And so it turns into this experiment. And I think that the best thing we can do as elected officials is go back to when we were making those videos, send the message, and be united in our opinion about this, and back our health officials, so that, you know, there's not a this speculation as to whether or not this thing really exists. But I think the CHI could, with the money that they have available to them, I'm saying that because that's an offer I'm making, to make some videos and get it out there on social media where people are beating up on each other over this issue. And I'd be willing to help with that and advocate for sending the CARES Act money that way.
Thanks, Chris. I appreciate that. You know, I will put a quick plug in for, if y'all have been on Public Health social media webpage in the past 2 weeks, they have been working super hard to respond to every single comment, and then manage comments that cannot be responded to. And it has taken a dramatic turn from what was, I would say, relatively toxic and difficult thread to feel safe asking a question on, to something that's generally very positive. And the comments that are coming back are now getting fed into the website for frequently asked questions. They get translated into new posts. Public health has definitely been working overtime to make that happen. It's exciting to see that transition. Jimmy, can I ask one follow-up question? And then I'm going to pass it over to Lori. And we have one more question about ag and industry that I would love for Lori to answer specifically, because it sounds like she's back. Jimmy, I heard you say early on about empowered leadership. And what I'm curious, what do you think empowered leadership would look like, and could the CHI, and what role could the CHI play in empowering those leaders that you're thinking of in a meaningful way?
Yeah, I think there's confusion at leadership levels, whether to believe this as a true pandemic or a farce, or whether to believe that masking is a good idea or not. And so I would think that open communication with leaders of the healthcare community, healthcare organizations, the administrators on here, I'd be happy to have discussions with anyone and come at it in an open and honest and listening perspective. Because I want to, more than anything else, I want to understand why people are doubters or people don't understand or are confused, and that helps me certainly respond to those leaders, but respond to other people that probably have the same questions but aren't as active in their discussion on it. I really commend public health for being so active, I guess, on Facebook and answering those questions, because I think that's providing an alternative to a lot of the question and answer that goes on in chat boards and things like that is less helpful and effective.
Great, thanks, Jimmy. I would have to give a special shout to Crystal Escherman, who is the regional epidemiologist doing a lot of work for public health on this. Lori, so you are on, that's great. I wonder, Lori, is there anything you would like to add to this last piece that hasn't already been said about the actions we could take as a community to slow the rate of COVID-19 as it currently stands? That's number one. And number two, could you speak specifically, this is a question from one of the CHI members, about the ag industry and health and safety practices, and how that, what sort of actions need to be taken on that level, or if any actions do need to be taken? We cannot hear you, Lori, unfortunately. Darn. No sound.
Did you lose your voice, Lori?
That would not be surprising. Be well deserved. Let's see. We'll see if we can get it back here. Oh, here she comes, connecting to audio. That's great. While Lori is plugging in here, Lori, you keep talking, and as soon as we hear your voice, I'm going to share with you all what the actual website looks like, because I heard it sounded like maybe some folks are not familiar with it yet. So this is the Okanogan County COVID-19 page. I have back indexes, so there's an odd bar up there, but just so you know, this is a place that folks are being directed right now to get COVID-19 data. It's updated daily thanks to public health. And they are doing a great job and working very hard to try to be responsive to what the community has been asking of them. So it actually lists COVID-19 cases by town. You can also see COVID-19 cases by age and COVID-19 cases by gender. There's also quite a few different drop-down things that are helpful. I think particularly safe reopening, which talks about what phase we're in and what's allowed at this phase and what's not allowed in this phase. The other piece I would direct you to is this FAQ page. So people can actually look at all of the different questions that have been submitted to the website or submitted to social media. And Public Health tomorrow will be updating them with questions that have been coming to them frequently. So I think it's a great and important page, and important for the CHI, for all CHI members. If you have information that you think needs to be on a website, I would encourage you to contact Public Health directly about that. You'll see there's other pieces on here about support and well-being, which I think is also a great webpage for folks to know about. You'll see that people can add community resources on this page, and Public Health then integrates them down below. So there's a resource list for Okanogan County, for the North County, South County, Meta Valley, food assistance, nutrition. I mean, all sort of speaking to some of those underlying social determinants that Jimmy was talking about. And in the end of the day, if we don't address some of those underlying social determinants, it's going to be a hard lift to get people to a place where they have the capacity to isolate or stay safe. So I'll stop with my screen share there. Lori, have we still lost your sound? Darn, I think we did. You know, I hear some folks talking about the impactful messages and getting COVID patients to record short testimonials of experiences. I'm wondering, from the panel side of things, you all relate to those folks quite a bit. That type of video messaging testimonial, how important do you think that is for us, and how important do you think it might be for the county to prioritize or utilize some of their CARES funding for that type of video message testimonial, that kind of a thing?
I think it'd be a huge help. I think it had an impact in Twisp when one of the restaurant owners gave a video testimonial. I think I saw it linked to on Facebook, but whatever platform it is, it can be shared and put on public health websites. But just to know somebody, to hear that they would hope that other people don't get it, and that maybe they're doing well, but what their experience was would be really helpful.
I think that would be a great idea to put that, get testimonials out there, and perhaps a patient might let us get a picture while they're in a bed and with a few tubes here and there, make it truly impactful.
Thanks, Alan. I wonder, among the current panelists, I know this is a very difficult question, and I think one that would be probably best pointed towards Lori, but there is a lot of conversation about agricultural health and safety practices in farm worker housing and pieces like that. Lori's nodding her head, I'm sure, wishing she could speak to it. I'm so sorry, Lori. You're welcome to chat something in if you'd like to. Anyone else on this panel have any reflections on that? That's one of the questions from the CHI members, sort of health and safety practices and what you think could be done on a county level to make those who are working in our agricultural industry safer. I guess, Chris, I think you'd have some great insight this as well, but anyone, I welcome your reflections.
I'm not muted. Family health centers, we've been doing outreach and education as much as we can. It's private property, so there are limitations, and some growers have been very welcoming, and we haven't had the access that we'd hoped to have, among others. And even so, we're trying to target times where more people are leaving the camps and coming into town. So payday or the weekend following payday is a hot time. And so we're going to try and do some education and testing and activities around that. You know, the whole concept of how the industry is structured is one that, you know, bears thinking about. I know that if I need to quarantine or stay at home, I can work off the sick days that I've accumulated, and then there's funding for me to receive 2/3 of my usual salary to continue to stay at home. But when you're paid in the number of buckets of cherries you bring home in a day, that's not the reality. And so I would say that's a detriment to the individuals, but detriment to the industry as well, because you know, if folks become sick, it's going to shut down the all wheels in the cog, not just those couple of individuals. And so trying to help industry come up with solutions, I think, is a worthy consideration. It's beyond the scope of a medical director's role, I think, but it impacts the health of individuals in our community as a whole.
Thanks, Jimmy.
Yeah, well, I just add, I was talking to Salvador at the governor's office, who I talk to almost every week. He came to this part of the country as his family being migrant workers, and his comment was the fruit's got to come off. And so, and he said it doesn't pick itself. And so, and process is so important to our economy. So whatever can be done to help those businesses who I know want to be safe, because it doesn't behoove them to lose their workforce. I encourage it however that can happen. And I don't have the answers to that. But certainly when those issues come up at the health board, I advocate for whatever we can do to help them keep their crews healthy.
Mm-hmm. Thanks, Chris.
I don't think
It seems like if you could make the investment in paying a couple people to stay home, you prevent a whole lot of people from getting sick and then nobody being able to work. So.
Well, I think as an issue, it's not a whole lot different than what the coal miners faced at the turn of the century and the early 20th century. And so, I mean, I think it goes back to, do we have the will to come up with the right practices and to help keep the workers safe, and then to educate them on how to do that. I don't think the work has to be impaired, but things have to change at the work site. And so, but that's, you know, that's kind of beyond what we can do in the healthcare community other than to raise awareness and educate. But I think that it's a larger societal issue, and I would think, personally, I would think different industries would have a strong interest in trying to figure out ways to help make the workplace safer from this disease. So I don't know if engaging them would make sense or not.
Jesus, I just, you are free to talk, actually. If you wouldn't mind just repeating what your reflection was in the chat box, I think it would be a great addition to the...
Well, I think we've, as Dr. Wallace mentioned, we've reached out to a lot of growers, and some growers have been very welcoming, some of the smaller growers, but some of our larger ones have been very resistant to really partner up and really partner with us in our efforts to really help keep their workers safe. And so we've had a death, one worker already in this county, and I think that the industry really risks, I think, stricter regulations if not enough of them get on board with a partnership with healthcare and others who are really interested and willing to really do a lot to keep ag workers safer. I think it's a big issue, and it's one that's going to be there for a while.
Thanks, Jesus. I appreciate that. I know that if Lori was here, she would also share that there has been quite a few more cases at businesses. There's been businesses from sort of OMAC down to Brewster. So I know we didn't get to talk much on how the business community gets mobilized to prevent or slow the spread of COVID-19 as well. But I do want to make sure and name that I know that's something she's talked quite a bit about. Let's see, how about any closing comments from you all as a panel? And then I will just show that data one more time for folks, and we'll wrap up.
Well,
it's exciting to me to hear. Go ahead, Commissioner Branch, go ahead.
I appreciate it, because my closing comment is I have another meeting going on with the healthcare, with the Association of Washington Counties are working on a work group or with a work group to address the healthcare authority in communications on the issues with mental health integration. And I happen to be on that. So I thought this was pretty important today, and wanted to participate. So I'll get with those folks and we'll figure out ways to better communicate with the healthcare authority, and any of you, especially you hospital people that have some ideas that I might be sharing with that work group, just contact me. You know how to get a hold of me. Thank you very much today for your participation.
We appreciate you being here, Commissioner Branch, and hopefully you can see you've got lots of support across the healthcare community for sure, and community health community in general. Jimmy, let's go to you. Last reflections before we sign off.
Yeah, I think it was really exciting to hear Sahara start this call with an announcement that more funding would be released by the ACH, and that we'd have access to that, specifically CHIs. I know many of us wanted the ACH to do a lot with social determinants of health, and to see that become incorporated into the primary care transformation work we're doing. I hope that the CHI would be able to access that funding and use it for social determinants of health, and use it to focus on the communities and folks in our county that need it the most. I think there's a lot of opportunity there.
Thanks, Jimmy. It's great reflection. I'll also say the NCACH gave the original grant to help sort of launch that website and social media. So definitely they have been very important out here for you. Alan, how about you? Any closing reflections?
Again, thank you very much for having me. Mid-Valley will continue to be very transparent in putting out data, in conducting tests, working with our other health partners with Three Rivers, North Valley, Family Health, and Confluence. And hopefully all of us together could reduce the number of situations we're seeing.
Thanks, Alan. How about you, Scott?
Thank you.
I don't really have anything to add other than to thank all of you for your support and for your interest in how to help us be successful and how to help our communities be successful. I really appreciate the spirit of collaboration that we have in our region. So thanks for the opportunity to be part of this.
Thank you, Scott. We really appreciate Jimmy's the Medical Director at Family Health Centers, Alan Fisher, CEO of Mid-Valley Hospital, Scott Graham, CEO of Three Rivers Hospital, Chris Branch, who's our County Commissioner. Andy Hover also recorded a short video for you all. So I will send that out by email. And Lori Jones, who the technology was just not a friend today, but is the Director of our Public Health, Community Health Department. Really appreciate all of you tremendously. And one of the things that Michelle and I have been doing throughout this presentation is summarizing what we've been hearing from everybody who spoke today. Oh, that is not there anymore. We're gonna stop sharing. We've been summarizing what everyone has been sharing today, and we will try to get those back out to the county commissioners and other folks so that we may be able to have a more unified set of talking points. I think the way that you all say it naturally is often going to be the same way that people actually hear it. It's going to be the message that resonates. So we'll do our best to carry forward all the great reflections you all have shared already today. With that, thank you, everyone. We'll have another CHI meeting next month. Michelle and I will send out more information and some questions for you all about fire and what further conversation you'd like to have around that. And please don't hesitate to give us ideas or thoughts on what you'd like the next CHI meeting to be. And thank you, everyone. Enjoy the rest of your very, very hot Thursday.
Thank you, everyone.